Welcome to COVID Chats and Facts with your host, Senior Diversity Specialist Amber Booth McCoy.
Hello, and welcome to this week's COVID Chats and Facts, sponsored by the UAMS Vision for Diversity, Equity, and Inclusion. I'm your host, Amber Booth McCoy, Senior Diversity Specialist, and this week we are talking about pregnancy, being pregnant during COVID, and what you need to know. In order to talk about that, we have the amazing Dr. Gloria Richard-Davis, professor in the Department of Obstetrics and Gynecology at UAMS College of Medicine, and the Executive Director of the UAMS Division for Diversity, Equity, and Inclusion. Morning, Dr. Gloria Richard-Davis.
Good morning, Amber. How are you?
I'm good. Thank you so much for being here with us today. So even though I know this amazing laundry list or a couple of amazing things about you, will you share with our listeners who you are?
So as you pointed out, I'm the Executive Director for the Division of Diversity, Equity, and Inclusion. I'm also a professor in the Department of OBGYN. My background in terms of women's health is I practiced general OBGYN for 6 years before I went back and did a fellowship focusing on reproductive endocrinology and infertility. And in my former position, I actually chaired the Department of OBGYN from the Harry Medical College and trained in terms of fellowship where I was faculty and supervised a very high-risk OBGYN delivery unit at Wayne State in Detroit. So lots of experience.
Very much. And you left off Amber Booth McCoy's favorite mentor. You left that part of yours of accomplishments in detail.
Okay, let's call it some more. My cruise with Oprah, or
yes. So let's talk about pregnancy. Like, one, it's been a long time since I had a child myself. My youngest is 14 years old. So let's pre-COVID, before there was a global pandemic, if I was pregnant and, let's say, going into labor, my water broke, like, on the television, and I started packing up stuff, what happened pre-COVID?
So pre-COVID, pregnancy, first of all, is one of the most monumental events in a woman's life. Mm-hmm. And so when we think about pregnancy, we think about the happy moments, right? That everything goes absolutely the way that it should. You have an uncomplicated prenatal journey, and then you arrive at the delivery. So typically what would happen is you would call your doctor and say, I'm having regular contractions, or my water broke, and he would tell you to come into the hospital. When you come into the hospital, there are a couple of different things to think about. One is the traditional vaginal delivery, which occurs most of the time, but there's also the risk of C-section. In the U.S., about a third of women end up with a cesarean section. And we can talk a little bit about that. But, so you go into labor and delivery, and you would have whoever it is that you want to accompany you, for the most part.
There's a party in the delivery room.
There's a party in the delivery room. I tell you, I've done deliveries where I swear there was certainly more family members than staff. Okay.
Okay.
And so very few restrictions in terms of what you can have or who you can have in the delivery room pre-COVID. Obviously, the focus is on the mom and baby and making sure that it's a safe environment. So that's foremost in the minds of anybody who is taking care of women in labor. And then, many women have made their own birth plans. So they may write out the things that they want in labor. Some of them do not want to have an epidural, right? They want to do natural.
Why would they want to do that?
I asked that question myself. But, but some do. And they prepare for that, right?
Right.
And they want their partner to cut the cord, so there are many different things that can be incorporated into a birth plan. So for the most part, when they're reasonable things, the physicians, the labor and delivery staff try and accommodate what their wishes are. So that's kind of the normal event of this.
So now that we are in a new world and we are now in a world with a global pandemic, what happens now? How different is that now if I were to go into labor?
So very different. Same for anyone who is admitted to a hospital in this current pandemic. For labor and delivery, they are restricted to one support person. And that one support person who comes is basically obligated to stay the entire admission. If it's just a vaginal delivery, then that's 48 hours. The one person also has to go through screening. And when I say screening, a typical COVID screening, making sure that they don't have any symptoms that would suggest that they may be carrying the infection. And when they're there, they have their temperatures checked every 2 hours because the emphasis is on making sure that we have a safe environment, that we're protecting our staff and other patients. So that's really the perspective from which many of these policies have been constructed. So it's not to, make it difficult for the patient and family, but it's all about safety.
Okay. So, like you said, mom would be limited to one visitor at this time, and that person stays the entire time. So I can let dad in on the first day, and then mom and my grandma in on second day type of thing.
No, you can't exchange people like that. Again, because you're trying to minimize the possibility or probability of someone coming in that is potentially a carrier, right? So you don't want a lot of people coming in and out. You want that consistency. You want that one person to come, and they really do need to commit to staying with you.
So, question. Now that we, moved all the way to delivery, we back up and we talk about prenatal care during COVID. If I am a pregnant mother, am I still going to the doctor's office the way I normally would every, for the checkup and into the office physically? How does prenatal care look different right now?
So many of the practices have tried to convert as many of the visits as possible to telehealth where possible. And again, it's largely about safety. If you don't have to come in, if you don't need to come in, many of the things that can be done or needs to be done in visits can be done via telehealth. The patients that have to come in, we certainly do have in-office visits for ultrasounds, for high-risk patients who may need, a little bit additional attention, then they would come in. The other thing that we have done is to reduce the number of required visits. So they're spread out a little bit more than what you would traditionally have in a non-COVID environment.
Okay. And if let's say, I'm sure that UMS is having, televisits and such. There may be doctor's offices or, obstetricians that run the state, maybe in rural areas, and they are unable to do those telehealth visits. If I'm an expectant mom, am I able to, and I'm scared, let's say, going to the office, Is it something that I'm able to have my records transferred, or am I able to call and see if I can become a UMS patient, or how do I go about that if I just do not want to go in there as much as possible out of fear, or is I just say I have to go to the doctor's office and not worry about transferring care? So your opinion on that, if I'm a scared mom.
So, in normal circumstances, it is always difficult to, as we say, doctor hop, right? Because especially in pregnancy, if you're late in pregnancy, physicians are liable for anything that happens in that pregnancy. So it's not often that you have physicians, readily receptive to taking on patients that are late in pregnancy. But what I would say is, UMS covers the state, essentially. UMS is the high-risk pregnancy service for the state. We do a lot of telehealth consults around the state. So our high-risk OB docs are readily accessible for any of the docs around the state. And while their physicians themselves may not have a telehealth service within their practice, they can always refer you, if necessary, for a consultation with a high-risk OB doc through UMS's telehealth services. Okay. And for most of our telehealth visits, you don't have to be, it used to be you have to go into a regional center. But now we have the ability to do this on your smartphone, on your smart devices. Right?
So I don't have to go. I don't have to change doctors at all. I can continue to trust the doctor, and then if I'm concerned, I can even ask my doctor to consult with a different physician. Is that correct?
Absolutely. And I would encourage patients to certainly advocate for themselves. If they are concerned, they should voice that to their physician. And then if they're still not happy with the response, you can always request that your physician set up a consultation. You can tell them what you're concerned about. And in these times, more than ever, you need to communicate what your concerns are. You know your body better than anybody else. And educate yourself.
And I got to know what I need to know, right? I agree. So if I am, let's say COVID affects pregnant women differently. Is there anything that, getting COVID is more severe for me because, I'm Black, or how does COVID affect pregnant women?
Well, let's kind of back up a minute and talk about which women are at increased risk of having adverse events.
Okay.
So if you think about without COVID, who are the patients who are higher risk pregnancy? Well, first is our African American women, right, among. We know we've been talking ad nauseum about the fact that African American women have a higher maternal mortality rate, 3 times that of our white counterparts. So that, far and foremost, is something to keep in mind. And typically, the issues that increases our maternal mortality rates are some of the underlying conditions the chronic conditions that we have, an increased incidence in our population, like diabetes, obesity, high blood pressure. Right? So if you have any of those, you're automatically in high risk pregnancy. Okay? And then you kind of go down to women who have previous C-sections. Right? They may have an increased risk of abnormal placental insertion or attachment, or they may have the possibility of uterine rupture if they go into labor. Then you go to the women who have higher order, that had multiple pregnancies. They're at increased risk of postpartum hemorrhage. Right? So after delivery, their risk factors is higher. So I think you have to then go from there, because that's your backdrop, that you always have to think about.
Right.
Then, as far as we know from the literature, but I say that tongue-in-cheek because remember, this is all new. And we have information that is constantly evolving as we experience this pandemic. And I'll give you an example. Up until probably 2 or 3 weeks ago, we did not do COVID testing on women that were admitted in labor or that were admitted when they came in for their scheduled C-sections. There was a hospital in New York who did do overall screening. Everybody who came through the door got screened. And they found that about 15% of those patients were positive for COVID.
Oh, my God.
Right?
15%?
15%. And they weren't necessarily symptomatic, at least at that time, right? So one is it means that we don't know what the asymptomatic rate is of infection. And two is it does potentially put your healthcare workers at increased risk. So we've all got to make sure and practice what we call universal precaution. Assume that they're positive when you're in the delivery room and use the appropriate protection. So those are really critical pieces. There are also some physiological changes that occurs in pregnancy that may increase risk, but so far we can't necessarily confirm that. One is we have, with the uterus expanding, you have lower lung capacity when you think about it, right? You breathe faster.
And COVID affects your respiratory system, right?
Absolutely. And sometimes women feel short of breath just normally, right?
Right.
So, so you want to make sure that you pay attention to those things, that you're doing the things that you should do, because sometimes the shortness of breath is because maybe you're dehydrated, right? So making sure that you're staying well hydrated, that you are seeking evaluation if you notice any changes, right? And then the other thing that happens physiologically is there is a certain amount of depression of the immune system in pregnancy in order for you to not basically attack that baby that's growing inside you, right? So that may carry some additional risks that we, again, are just not aware of. Because when I think back about women who have pneumonia in pregnancy in non-COVID times, they have a higher mortality rate because of all of these changes, physiological changes.
I think I never knew that.
Yeah. So, you just have to keep those things in mind and be very judicious, I would say, in evaluating and monitoring our pregnant patients.
Okay. So let's say that I have been tested. I am here for delivery, and it is found that I am positive. I have COVID, and I'm, here to deliver. How does that change the maybe birthing plan that I had, or even the normal visitation, or if that's, going to happen, or any of that? What happens once I'm positive?
So certainly the first thing that the hospital is going to do is to isolate you. Because they want to make sure that they're not spreading the infection, right?
Right.
So rooms are specifically set up. They're going to probably minimize the staff that goes in and out, right? So there are protocols specifically set up to handle patients who are positive that happen to come in labor.
Okay. And if I am positive, I mean, can I transfer COVID to my baby, to my infant?
Again, that information is kind of evolving. One is certainly the concern is after delivery you can transfer it. Mm-hmm. So you would not want your baby running in with you, right? Until you've gotten through that period of time that you are potentially infectious or that you can translate the infection. The other thing that we don't know is what sort of happens in utero during that pregnancy. There was an article I was reading recently that suggested, I don't remember from the Italian literature, it wasn't U.S. literature, but they were actually testing the placenta from women after delivery. And they were able to identify COVID virus in the placenta. So, again, I think, it's kind of like stay tuned.
Right.
I think this information is evolving, and it may change what the recommendations are, just like all of our guidelines have changed as we learn about this virus.
We're still learning about the first SARS epidemic, is it not? For pregnancy and side effects to women even then?
Absolutely. Absolutely we are. So, be flexible at this point, I guess is what I'm saying. And continue to educate yourself and stay abreast. And I'm sure that your physicians are doing the same.
So you said if I am positive, I'm going to be placed in a room and isolated, and even if that is, reduced. Now, we're talking about vulnerable populations, which we're talking about the maternal mortality rate for both women. What's the implication or maybe the risk associated with limited staff for Black women? I mean, how my person, my visitor need to, change, or do they need to accommodate, make sure I'm healthy and taking care of the way I'm supposed to be?
I think it just underscores that you have to be even more judicious about advocating, right? Because, I go back to the backdrop in which most healthcare systems are functioning right now. We're kind of stretched thin. We're stressed, right? Mm-hmm. And there certainly is higher probability or potential of missing some things. So the patient and the support person the patient knows her body better than anybody else, right? And that support person who is with her probably does as well. So if there's some things that they're concerned that they're seeing happening, that they're concerned about, is to make sure and bring it to the attention of the staff people, right? If you don't get the response you need now, I keep saying speak up, right? Speak up. I'm not saying get boisterous or be angry about it, but tell them in a very factual way what your concerns are, right? It's like, look, I'm having more pain than I expect to be having, right? If she has an epidural in or she needs to have an epidural in. Or after delivery, I'm bleeding heavily. I'm bleeding more than I would think someone should bleed after delivery. You have to make sure that they're aware of those things. Because the staff will be coming in and out. But, you think about under normal circumstances where you might have vital signs done every 4 hours on patients in the hospital, right? So what happens in between those 4 hours if things have changed?
So
communicate.
So advocate. You know your partner, you know yourself better than the healthcare workers. They're meaning their best. You're saying, I still know my body best, and my mother still knows me and your body, best. And so it's not necessarily that it is about, I guess, yelling, but it is about being adamant that, something is not right here, right? Because I'm not a doctor, so I don't know exactly what's wrong. I just know something's wrong, something ain't right.
Exactly. That's right. And communicate with that something ain't right is.
Right. So what is mom looking for? You know what I mean? Like, would it be just maybe maybe I'm sleep fewer than normal, or maybe what are the signs, I guess, that should let me know maybe I really need to start stepping up and telling the doctors that something is different? Is there anything, that stands out?
Well, so like in labor, for example, the things that we get concerned about is headaches that's unrelenting, right? Mm-hmm. Increased shortness of breath, pain in excess. So typically you have contractions that come and go, right? Mm-hmm. But maybe your pain is not even relenting. It's not going away in between. That could be signs of abruption, right? Mm-hmm. So things that are out of the ordinary, do not hesitate to ask the question and acknowledge what your concerns are. What's happening that you don't think is normal, okay?
Okay. I would say I have no idea what pain is when it comes to childbirth, because after that first contraction, I'm like, yes, I'll take that epidural. I changed mine. I'll take that one. So thank God for epidural. It comes to...
You're kind of breaking up.
Oh, can you hear me now?
Yes.
Mm-hmm. Okay. I'm saying I thank God for my doctor who was before. I also have no idea what pain feels like during childbirth, because that epidural is a beautiful, beautiful thing.
Yeah. Uh-huh.
So
I agree.
Before we go to break, you can just kind of tell us if I have to stay, or if I'm discharged and the baby has to stay, does that look different during this time as well? Are we able to visit the baby if the baby has to stay?
So if the baby has to stay, the mother can stay with the baby. Okay, mm-hmm. So there are allowances made for that. You don't have to be separated from your baby because it may have some additional reasons that they're monitoring them. Maybe their bilirubin is up, or their weight is not quite where it should be in order for them to be discharged. Or maybe they're having a little bit more what we call tachypnea or rapid breathing during that newborn or immediate postpartum period, post-delivery period. So you can stay with the baby. But like this, we talked about with the support person, you can't come and go. You need to stay.
So staying with the baby, it is just that I am staying with the baby. I can't come in and out of the hospital.
Correct. They're going to ask you to remain and not risk your going out and getting an infection and bringing it back to the baby and other people in the hospital.
Okay. And when I am thinking about going in and eating that person that's coming in with me because, this is the support person that I've chosen, is there any that you would recommend, like as far as, if I'm having to decide between, mom, husband, sister, that kind of thing, are there any guidelines as choosing that you think I should follow for who would be the best person to stay with me during that time?
I think a lot of that depends on your emotional support. Right? Because, as I said, this is a really special time in a woman's life. And I would assume that they probably want to share it with their husband, with their partner, right? Mom is absolutely great in terms of supporting your children, but you kind of have to make that decision as to what's most important. Is it someone who, is it that emotional tie, right? That security, that person who makes you feel better? Or do you feel like you need someone who has had the experience of childhood, kind of knows what to expect, and who will sort of be more adept at paying attention to the thing? Now, I say that with some sort of trepidation, because women who have done prenatal classes with their partners, right? Mm-hmm. The partner may be just as educated and aware as mine.
Well, one thing, Dr. Richard, is we are going to go on break. I will thank you so much. So you are listening to COVID Chats and Facts, and we will see you after these messages.
Okay.
Every 10 years, the census comes along, and it seems like everyone I know always asks the same two questions. What is the census, and why does it even matter? Let me give it to you straight. The census counts every single person living in America. An accurate count of our community tells us where there are more people, and where there are more people, there are more needs. Our participation could impact how public funding flows to our schools, health clinics, senior care, job training, and housing. It even determines our congressional representation. I don't know about you, but it sure sounds like the census matters to me. This year, take a little time for the 2020 census. You can complete it online, by phone, or by mail, and make sure you count everybody you live with. Your mama, daddy, sweetheart, babies, roommates, everyone. This chance only comes every 10 years, so let's step up and be counted.
Shape your future. Start here. Learn more at 2020census.gov. Paid for by U.S. Census Bureau.
Many medicines used to treat colds and flu contain acetaminophen, a pain reliever and fever reducer found in hundreds of over-the-counter and prescription medicines. But taking too much or more than one medication containing acetaminophen per day can damage your liver. So always read the label and don't take acetaminophen if you drink 3 or more alcoholic drinks every day. To learn more, visit fda.gov/OTC pain info. A message from the U.S. Department of Health and Human Services Food and Drug Administration.
Thank you for listening to the programming here on KABF. Our purpose is to provide music and information that's beyond the mainstream. To achieve that goal, we ask you, the listener, to help us in that task. So here's your opportunity to become a supporter of community radio by giving a pledge. Call now at 433-0088. Your contribution will assist in expenses that are necessary to keep KABF on the air. Broadcasting at 100,000 watts since 1984, KABF is Arkansas's only nonprofit, non-commercial radio station run by volunteers. Again, call 433-0088 and tell us your pledge. Payment is easy by Visa, MasterCard, or American Express, or mail your donation to 2101 South Main, Little Rock, Arkansas, 72206. Thank you from the volunteers at KABF. Pledge now.
Welcome back to COVID Chats and Facts. My name is Amber Booth McCoy, and I am the UMS Division for Diversity, Equity, and Inclusion. Today we are talking about pregnancy during COVID. So if you missed the first half, that's okay. We still have the amazing Dr. Gloria Richard-Davis here with us to keep us informed and tell us everything we need to know. So thank you again for being with us, Dr. Richard-Davis.
My pleasure.
So we've talked about, prenatal health. We have talked about delivery. Let's talk after I've had this baby. Let's say postpartum. I've had this baby, and a lot of times we talk about postpartum depression is what comes up, the mental health part of having a baby. I remember, if I remember anything else, I remember being exhausted as a new mom. I remember being tired, and that was with help. That was with my son's father, my mother, all of that. So what are those practices or care? Because we're a completely new world right now when it comes to what family, being able to interact and social distancing and all of that. How do I, one, better protect my mental health during this time while simultaneously protecting my baby during this time?
Absolutely. And I completely concur with what you're saying. I remember being completely exhausted after delivery, and that was with all the support people possibly being there. So this is definitely a unique situation, and unfortunately, the things that I would say women or moms need to think about is, if you live in a household and you already have those people in your household, it's still the same precautions that we have continued to underscore, and that is the people who are living in the household need to make sure that they are adhering to wearing a mask, social distancing when they do go out, right? So that they are less likely to become infected and bring that infection home. Hand washing, all of the things that we should be practicing when you have a new mom and a new baby in the household. That should just be elevated. Your antenna should be on red alert, okay? Mm-hmm. And so it's not to say that you have to endure all of this by yourself, but you have to take those precautions, right? So if your significant other, your husband, is going out to work, he needs to do the things that we just talked about. If your mom doesn't live with you and she's coming in to help you, same thing, right? And if you are really concerned, maybe that they wear a mask the whole time that they're with you. Right?
Okay.
I mean, just go above and beyond.
Gotcha. Everybody that comes to the door must wash their hands, have their temperature taken, and wear masks until
Absolutely. That's right. Don't touch me until then.
Do not touch me, or do those. Have you seen the drive-by toys that people have been doing for maybe the elderly or birthdays, things like that? Maybe you just have one so we can just kind of get in the car and drive past. You can just kind of show TV, and you don't have to even come in the house at all. So, when you're talking about postpartum depression, what are the signs of postpartum depression? What are we looking for in that?
So, we talk about differentiating between postpartum blues and postpartum depression. Because, it's not uncommon for moms to feel a little depressed after delivery, or overwhelmed, I should say, right? You're not getting the rest that you typically do, so you're already irritable, all those things. So first is making sure that you are doing the necessary preventive things to minimize that. Eating healthy, staying hydrated, exercising when you can, practicing positive affirmations, right?
Okay. Positive affirmations. Okay. So if I'm making sure that I'm being positive affirmations, I'm hydrating, I am, doing well, eating well, that kind of thing. And then as far as the depression specifically is concerned, if anything that I'm looking for, or let's say it's my sister or some, with just delivered, maybe that I should be concerned about. When should a family member think about stepping in if they see what's signs?
So if you've gone beyond just feeling a little blue, and most women know that, they know what it feels like when you start to feel that sort of sense of helplessness, your world's out of control. We all have anxieties, right? But your anxiety is never alleviating, right? It's never really going away. Or you start to have real concerns about whether you are able to take care of your child, or, worse yet, having any ideas of harming your child or yourself, then you certainly need to seek professional help. That's beyond just, postpartum blues. That's getting into depression. And if you have somebody who has a history of depression that preceded pregnancy, they're even more likely to have depression, significant postpartum depression after delivery. So be aware of that and seek the appropriate help that you need.
Okay. And what are the things that, as far as, I think I'm in the clear, I've been released, but what does it mean as far as the mom is concerned that I am all good, right? There are several complications that can happen after delivery. Is that correct?
Absolutely. Particularly for, and I'd say our community, our African-American moms, we have an increased risk of preeclampsia in general because there's sort of an underlying hypertension or high blood pressure. Yes.
And can you tell us a little bit more about preeclampsia? Those of us who, maybe did not go or did not work at UM, what is preeclampsia?
So preeclampsia is a condition that occurs during pregnancy, which there are several things that we look for. One is you can start to get, basically what happens is you get a lot of fluid that starts to third shift. It starts to go into spaces where it should be, out of the blood system, right? So you start to potentially have things like headache, visual changes. Your lower extremity starts to swell. And for many women, we have some swelling anyway. But beyond the swelling are there other components that are present. So symptomatology. The other thing that we look for in terms of what we monitor in women when they come into their prenatal visit, if you remember, they always get a urine sample from you. That's the first thing that they actually do in the cup, right? Right. So from that cup, from that urine sample, we're doing dipstick, looking for any protein that's spilling, because that's sort of one of the earlier things that we start to see in preeclampsia. And blood pressure checks, always. Blood pressure check, checking for protein in the urine. Those are critical parts of monitoring women in pregnancy, looking for that. And we talked briefly about the young lady, very, very sad case in New York, where she had her probably last prenatal visit before COVID hit. And she had her blood taken, blood drawn. And in her specimen was she noticed her platelet count was low. So, we have access to our personal health records, right?
Right.
So you can go in and look at what your lab values are. And if there's anything abnormal, it's usually in red, right? You don't have to know what normal is, but if you see red, it's not normal.
Right.
Okay.
Right.
So, so that's one of the things that can happen is your platelet count can begin to drop. That's a pretty serious concern, because that means you really are going into a more severe state of preeclampsia. And preeclampsia, we talk about mild to severe. the mild are the things that I sort of said. Your legs swell, you might spill a little protein, your blood pressure may be a little high, but you can do things that will help to mitigate that, making sure you're getting adequate rest. Continue to monitor it. When you start to get symptoms like headaches, significant weight gain because of the fluid retention, right?
Okay.
Your platelet counts are dropping. They check your liver function tests, and they're becoming abnormal. Now you're moving into a more severe preeclamptic state. And typically when that happens, they admit you to the hospital. Okay? Because we need to monitor a lot more closely and make a decision about when you intervene. And intervention means delivery.
Oh, okay.
No matter how far pregnant you are, okay? Because you can treat preeclampsia with medications, but not everyone will respond to it. We use max sulfate intravenously to mitigate against seizure activity in preeclampsia, right? So, you get admitted. There are certain protocols that we follow. If things don't get better, if your platelet counts are still dropping, if your liver function testing is still going up, that starts to signal to your physician that perhaps it's time to go ahead and deliver this baby, because that's what's going to make you better, right? And so I said severe preeclampsia. The most severe thing that can happen is you start to have seizures. And so we never want to get to a point where you're eclamptic. That's when you're having seizures. So you go from mild preeclampsia to severe preeclampsia.
So if I had delivered and I had preeclampsia in the clear, should I just, if everything seems normal, just continue as normal, or should I still need to take extra precautions? Well, no. What should I do at that point?
So after delivery, and the American College of OB/GYN, it's basically deemed the postpartum period the fourth stage of labor, right?
Okay. Oh, wow.
Because you do still need to be aware of, especially if you've had any of those things in labor. For example, you're preeclamptic or you're diabetic, right? Or you had postpartum hemorrhage. So there are additional risks for patients who have experienced any of those things. So once you deliver the baby, preeclampsia should improve. But there are some women who actually have late onset, or they have a return of those symptoms. They don't completely abate. They may need to still be on blood pressure, antihypertensive, or blood pressure medication, right? After they deliver, they may still need to be on it. Maybe you were sent home and you didn't have those problems in the hospital. But you start to notice that you have headaches, right? Or that my allergies driving me crazy. Or that you start to have headaches, or you're bleeding more than you thought you should bleed, or you're having any visual disturbances. Any of those things, you should be on the telephone calling your physician. If they don't...
Okay, so since you found whether it is prenatal, during delivery, or even after delivery, I am the expert of my body, and I need to be watching whether I have, whether it's diabetes or anything that I'm concerned about that seems ordinary. I think things have been your advice for everything, like all of the whether it was during or after, I know my body. I'm not even looking for symptoms and signs because I'm a trained physician. What I am saying is that something is wrong and I need to contact somebody.
Yes, if you think something is wrong, you should call and get reassurance as to what it is that you're experiencing. Is it normal? Is it not? If you continue to experience it and you don't feel like it's been satisfactorily addressed, please call again. Don't just not advocate for yourself when you yourself know that something's not right.
And as far as breastfeeding, as normal, like pre-COVID, you breastfeed, post-COVID, you breastfeed, or does that look different now, whether I'm positive or not?
So if you are not positive with testing for COVID, then absolutely we want to encourage breastfeeding. That is the best thing for your baby. However, if you are positive with COVID, then we talked earlier about the fact that you're probably going to need to be quarantined, right? You need to be isolated. And so if that happens, you may still pump, right?
Oh, okay. I can still pump. I can still breastfeed. I just can't physically breastfeed if I'm positive.
Absolutely. And so, I'd have to go back and actually look in terms of literature whether or not they feel like for COVID testing, the assay or the test that we use is a PCR test that looks for viral particles. So you can do that in urine, you can do it in blood, you can certainly do it in testicles if necessary. But I don't know with certainty that it's necessary, right? Particularly if you're doing the hand washing, you're doing the precautionary things, you're wearing masks and you pump, right? Those would be important things to make sure that you do if you are going to pump.
So let me make sure that I am following all of this and all the information that you have told me thus far. I am not pregnant. Those of us who are listening, and for all my friends who currently are pregnant, so I make sure I'm sharing accurate information with them. One, prenatal visits, they was a little different during COVID. They've been, shortened, if you will, or fewer, and a lot of them happening via telehealth, right?
Yes.
And then they're happening via telehealth. And just because my doctor doesn't have telehealth set up doesn't mean that if I'm concerned about something that I cannot ask my doctor to consult with a different physician or a different high-risk physician that maybe does have telehealth visits.
Absolutely.
Two, that the wonderful birthing plan that I had that involved my KG music, my 5 cousins, my mother, and all of my friends may be different after COVID because of the limited people that are allowed to bring with me. Right?
That's correct. And I want to just kind of add, I know that it's disconcerting for this to happen to you, but to think about why these policies are in place is for your protection and for the protection of other patients and employees. And in addition to that, when you are in the hospital and you have a lot of visitors, those visitors can sometimes be a distraction to your care as well. Right? So,
and I need all of it on me, all attention on me.
Yes. And want the staff pay attention to you.
So I need to call my doctor and make sure that the birthing plan that I had is still what needs to be removed or how we're changing the plan and how I go about changing the birthing plan.
Yes, I would have that conversation with your physician before you go in. And they should actually be having that conversation with you anyway. Okay. Because almost every hospital has changed their policies. So while we know what's happening at UAMS, I don't know which hospital you're going to go to. And what are their policies? New York hospitals have gotten so strict that they're thinking about not even allowing anyone in at the moment.
Oh, wow. So I need to know where I'm delivering. I need to know what those specific policies are because they can change by institution, correct?
Yes, that is correct.
Okay. Now, once I have read all that I need to know about my institution, I have chosen a visitor, and I go in to deliver. I am making sure that my visitor knows that they are with me for 48 hours and or 72, depending on the time of delivery that I have.
That's correct. And that they will be wearing a mask and that they will have their temperature checked.
Okay.
So, expect those things to happen if you're doing that.
And acknowledging that, let's say if I am positive for COVID, test positive, my number of staff will be limited. And thus it is very important for me and my visitor to stay intelligent and pay attention to signs that could be, seminal or warning signs about my health.
Absolutely. Absolutely. And I would say that, no matter what, that should happen.
Right. So after delivery, when we come home, we're going to continue to be safe, maybe allowing, very few people covering up with masks. So same precautions. Like I said, wash your hands or you touch me or my child. Very, very diligent. Are the postpartum visits also done via telehealth?
Yes, they can certainly be done via telehealth. As I said, unless there's some other signs or symptoms that the patient is experiencing that they feel like they need to come in. But, for the most part, if they are uncomplicated, they're not having any concerning symptomatology or signs, the telehealth visit is perfectly acceptable for them.
And, Dr. Richard-Davis is always thankful that I know you, thankful I can call on you. Before we get out of here, are there any closing remarks or things that you'd like to tell our listeners that they need to know that it's most important? Maybe your last, remember this.
I guess we can't underscore enough is making sure that you do as much as you can to educate yourself, right? And that your support people do the same so that they can be the best assistance to you possible. The other thing that we talked about, which is critical, and that's your emotional well-being. All of us are stressed under these conditions, and so it's important to do the things that's going to make you feel better, feel healthier. You talk about you feel better if you're dressed, right?
Mm-hmm.
If you look good, you feel good. So it's important to get out of bed and do the things that you would typically do. Get out, exercise, eat healthy. I saw a video, an interview with Sheryl Sandberg, CEO for Facebook. And it was with she and her therapist. And she talked about after having lost her husband, how it was very difficult for her to get back, right?
Mm-hmm.
Because it was like, in this really black space. And her therapist said to her, well, think about it. It could always be worse.
Mm-hmm.
She's like, what do you mean it could always be worse? I just lost my husband, unexpected, young. And he said to her, your husband could have had a heart attack driving your kids.
Mm-hmm.
Right?
Right.
I mean, we don't necessarily want to wish that on anybody, but I say the same thing to my kids. It could always be worse.
So it's all about outlook and making sure that we are able to modify the process.
Absolutely, and appreciating the things that are going your way, that are positive in your life right now.
Well, thank you so much, Dr. Gloria Richard-Davis, for that. We thank you for tuning in with us today. My name is Amber Ruth McCoy. Next week on COVID Cats and Facts, we'll be talking money. Business and finance. Yes, business and finance during COVID. So thank you for joining us. This is COVID Cats and Facts. My name is Amber Ruth McCoy on KABS 88.3. Voice of People. You have an amazing day.
You've been listening to COVID Chats and Facts with Amber Booth McCoy, brought to you by UAMS, Division for Diversity, Equity, and Inclusion.